Hi, I'm Andrea Fava, and I'm an assistant professor and director of the Lupus Translational Research Program at Johns Hopkins University. Today, I want to tell you about very exciting research that we are going to present as an abstract at the American College of Rheumatology Convergence meeting. My research is on lupus nephritis, which is when there is inflammation in the kidney in patients with lupus. Unfortunately, most of the times this comes without symptoms, and therefore we have to rely on screening the urine of patients for protein. When patients have too much protein in the urine, we react with a kidney biopsy to diagnose the disease, and then we treat with immunosuppression, sometimes having to muster side effects, and we monitor the response to treatment based on the reduction of this amount of protein. However, this has limitations. The amount of protein in the urine, it's not a very reliable biomarker. We do know that patients may have protein in the urine and not having inflammation. Other patients have a lot of inflammation in the kidney and do not have protein in the urine. And therefore, when we treat patients and we just monitor the decrease of proteinuria, which is the name for urine protein, we may treat these patients in the dark. And so in the last few years, we've been studying, along with the Accelerating Medicines Partnership, biomarkers in the urine that can tell us if there is inflammation in the kidney. We found several that outperform proteinuria in telling us if there is true inflammation in the kidney. Now, what we have looked at is whether the decrease of these biomarkers in the urine is a useful biomarker to predict long-term outcomes. At the end of the day, that's what we care about. We care about saving kidneys in patients with lupus. Well, we hypothesized that if we, with treatment, are able to reduce these biomarkers to a normal level, that means there will be no inflammation in the kidney, and therefore there will be no accrual of damage over time. Conversely, patients that have persistently elevated evidence of inflammation in the kidney, these are the patients who will lose kidney function over time. What we have found is that patients that after 6 or 12 months of treatment, if they had a persistence in the urine of these biomarkers of inflammation, these patients had a much higher risk of losing kidney function permanently or to the point that required dialysis or kidney transplant. And this was better than just using proteinuria, which is what's used in the clinic right now. So this study is very exciting, has implications both for clinical practice, but importantly for clinical trial design, because it's very hard to get a positive trial in lupus, and sometimes that's because the outcomes that we choose, it's not a precise one. And these biomarkers may prove better than the current targets, and so can lead to a better clinical trial design, and therefore better treatments for patients. If you want to learn more about this, please join us. There's a couple of sessions in which we'll be talking about these biomarkers, and you can find also this information on the abstracts on the ACR website. Thank you.